Hello, I'm Dr. Babamiri. I'm going to talk to you about bioidentical hormones in this video. Hormone replacement is commonly used in medical practice to restore level of certain hormones that may be lacking in the body, and this is commonly referred to as hormone replacement therapy, or HRT. Bioidentical hormones are synthetically made and structurally identical to your hormones found in your body. They're derived from plants, but they're structurally modified to mimic the function of internally produced hormones. Every patient is different, considering bioidentical hormones, and each plan is tailored to your needs. During your initial consultation, we undertake a thorough medical history, explore symptoms that you might be experiencing, and then we perform some investigations such as blood test, ultrasound scan, or imaging, such as mammogram. The blood test will provide us with a hormonal profile. If the hormone levels are consistent with the symptoms that you're experiencing, we discuss options. The treatment plan always includes regular follow-up and ongoing monitoring. We also discuss lifestyle changes that may help your symptoms. So bioidentical hormones have many benefits, including improvement in menopausal and perimenopausal symptoms, reducing night sweat and hot flushes, increasing energy levels, improvement in libido and skin quality, improvement in memory, concentration, also bone density. The therapy is in form of creams applied to the forearm skin, and this method will bypass the liver and gets absorbed straight into the bloodstream without causing side effects or reducing the side effects such as blood clots and thromboembolic events. Some of the hormones are given in tablet or capsule form. I hope this explains what we do during consultation by identical hormones. Thank you.